Okay, today we're talking about different ways of doing chiropractic adjustments to help correct misalignments in a person's lower back. Different people are built differently and their bodies react differently to different adjustment styles. So we have a myriad of techniques to help us with that. This is an example of an adjustment that will be done on a person's healthy lower back. We're going to roll them. This is called a side posture adjustment, rolling them forward, putting a little bit of pressure on the vertebra and adjusting. Pretty simple, very straightforward, should be pain-free and feel great, helps to realign the vertebra. In this case, a person might have pressure in their back from a swollen disc on one side or the other. We need to take that disc and open it and get rid of the inflammation. So we use an awesome technique, it's very comfortable, called flexion distraction. Our patients love this type of an adjustment. The table is on a hinge. It opens the joint. The chiropractor can control with exact force the amount of pressure that we put here. And we can also move the vertebra from one side to the other. This would open up, in other words, the left side. That's a fantastic adjustment. It's very comfortable to help with the misalignments in the lower back. If our patients are not okay with the twisting maneuvers or some of the flexion, is when the table will assist us with the adjustment. This is called a drop technique. It's very light. In this condition, I would be working on a person's pelvis or in the lumbar spine. In this case, the table, we would cock up the drop piece and it just drops out. So when I put pressure on the top, bring the joint into tension, give an adjustment just like that. Very comfortable, no twisting or popping movements are heard by the patients, and people really like and enjoy this technique. And in the very lightest type of technique that we use for lower back or lumbar spine adjustments, occasionally our patients cannot tolerate other types of adjustments. Maybe they have osteoporosis, maybe their muscles are splinted too much, or they are not reacting well when we do other types of adjusting. So in these cases, we can use an instrument. This is our very advanced instrument called an impulse. In this case, I will be working with posterior misalignments in the lower back, utilizing the instrument tool. The tool will tap on the back of the vertebra in question and give a single beep when the adjustment is successful. If there's two beeps, it means the misalignment is still present, and we address that from a different angle or location. So this is a very interesting and awesome tool that we've added to our repertoire for light force adjustments in the lumbar spine.